lots of at-risk people in the community. So you really need to be proactive all the way around.
From the elderly to those living with disabilities or pre-existing conditions, when it comes to the potential spread of coronavirus, those groups continue to have the highest risk. Channel 3 New Haven Bureau Chief Matt McFarland is live in the Elm City tonight, where leaders continue their push to get the word out. Matt?
Well, Dennis, preparation, not panic. That is the tone from experts. They say even if you are relatively healthy, they say they don't want you to ignore those warnings about those preventive tips they want people to take. That's because by keeping yourself healthy, you can keep others healthy as well.
Initially, the advice was not to worry except for people with health conditions. And of course, my group of friends and colleagues and citizens with health conditions became increasingly concerned.
And Michelle Dupre, who heads up New Haven's Department of Services for Persons with Disabilities, says with the growing concern over the coronavirus spreading, those in high-risk groups like herself need to plan accordingly.
Elderly, people with health conditions, disabilities should really be seriously thinking about not going out very much at all.
That's because those folks are at the greatest risk.
The virus is spreading faster than the CDC and scientists can project. However, we are staying informed and informing the public as quickly as we can.
In addition to practicing good hygiene, New Haven's health director says the best way to prevent any potential community spread is to limit large gatherings. It's why the city closed all of its schools indefinitely, along with its libraries and senior centers.
When we're talking about social distancing and keeping 6 feet apart, is that if you are sick, we're urging you to please be socially responsible and not expose others.
So the city is also reminding residents to be prepared, just in case they have to quarantine or isolate. That means having food, basic home necessities, and medicine. And Michelle says she's already taking steps herself.
Trying to limit my touches of services outside my home and office. Just really trying to be extra careful. And, you know, there may be a time where I choose to work remotely.
And Michelle says it's important for those that are healthy to take those precautions as well, because as doctors have said, for most folks, they might see just some mild symptoms and recover. They could easily pass it on to those who are at high risk, and then that would be a problem. We're live at the mobile newsroom in New Haven. Matt McFarland, Channel 3 Eyewitness News.